Do you suffer from interstitial cystitis? Do you suffer from a chronic, painful bladder condition that's affecting tens of thousands of Americans, tens of thousands, even into the hundreds of thousands of Americans, as well as other parts of the world? There are men, women, children suffering from a chronic bladder problem known as interstitial cystitis, even suffering from a condition called incontinence, where a person may not be able to hold the bladder in control. So instead of leaking, whether it's just from sitting in a chair, laughing, or climbing stairs, or getting out of the car, or rolling over in bed and losing control of the bladder, or wearing a diaper, or wearing a pad, whether you're younger or older years of your life, the chronic bladder problem comes from various different tissues in the body, which I'm going to outline here in just a moment. But I want to make one point in particular of one part of the body, and I want to make this video pretty short to get to a couple of points here so that you can have a greater expansion of your awareness of what really is driving your condition, where the antibiotics and anti-inflammatories have not helped you rid your chronic bladder weakness or chronic bladder pain. So one tissue in particular, in addition to what I've, and watch my other videos on interstitial cystitis here, I'm having great success with people relieving their chronic bladder conditions and relieving their, whether it's called interstitial cystitis or chronic urinary tract infections or even incontinence. One part of the body in particular, in addition to your bladder muscle, in addition to your bladder sphincter, in addition to the urethra, in addition to the ureter, in addition to the kidney, one other part of your body that your doctor, your urologist, or a nephrologist, or whatever kind of doctor you've been to, and whatever labs you've had done, like cystoscopies and blood tests and urine tests, one other part of your body that the doctors have most likely not explored and may not even realize that they've got to explore, and they're supposed to be your specialist helping you, is a part of your brainstem. It's called your pons. P-O-N-S. Here's the word right next to me, the pons. P-O-N-S. You have a brain, and inside your brain and coming out of the brain, you have what's called the pons. P-O-N-S. The pons is the middle part of your brainstem. Inside the pons, you have an area called the micturition center. I'll put that word up here, micturition center. It's also known as the urinary reflex center. Well, here's how your brain tells your body, tells your bladder when to evacuate the premises, when to evacuate the bladder, the fluid in the bladder. And you know, before I even get to that point, there are people who tell me, and I see lots of women, I've seen some men who have chronic interstitial cystitis after medications didn't work and labs could not find, and different imaging studies could not find what was going on with their bladder. And the doctors just said, you're just going to have to live with it. And people try alkaline diets, and they try different diets, and they try drinking different things and so on that are not giving them the relief. Some people feel a little relief with their diet change. Some people feel a little different relief with a drink, you know, not drinking certain other things in their life that they once did drink. But the reality is there are the majority of people who don't notice any change, or very little, if any, change in their bladder, lack of bladder function. So, lack of bladder control, I should say. So the pons has nerve signals that it sends down to your bladder muscle. So the bladder muscle, the bladder itself is made of what's called the detrusor muscle. And the detrusor muscle has to stretch. It has these stretch receptors. So just see, if you could look close here, my fingers are together. They call this the bladder. As as fluid, urine is actually dropping from the kidney down through the ureter down into the bladder, where the bladder is going to contain that fluid until it stretches to a certain point. Once those stretch receptors in the muscles of the urine bladder stretch, a signal goes right up to the brainstem, to the pons of your brainstem. And the pons says, okay, I got the signal, you're full. So now it sends down a contraction, a muscle contraction signal to make that bladder squeeze out all the fluid, the urine, to let you evacuate that bladder. So when the bladder gets full, stretch, you go, brainstem, pons gets the signal, okay, I hear you down there, bladder, you're full. Let me squeeze, let me send down that squeezing muscle contraction signal. When you want to be able to squeeze, let's say, ketchup out of a ketchup plastic bottle, you squeeze the bottle to get more out. Well, in order for you to get the fluid out of your bladder. It's not just open up a sphincter, which is a muscle controlled by certain nerves, by the way, that come out of your spine, and I've talked about in other videos of interstitial cystitis, which I'll put the links below this video so you can easily click on there and look around at the other information, unique information that can change your life for you that I put up on my YouTube channel. But it's not just about opening up a muscle here to let the bladder release. It's a contraction that happens to the bladder to squeeze out the fluid in there. So when you feel that you are full in the bladder, we've all had this, where we get to the bathroom, it's just like, when you're letting it out. Well, the pons of your brainstem, again, got the signal, stretch, boom, it sends a reflex action down to the bladder to squeeze out the fluid. Now, what happens when the pons of your brainstem is infected? What happens when the pons of your brainstem has toxins? And it can easily get into your brainstem. Let me show you a picture here real quick of the jaw. See this picture on my left? This is a skeletal image, a drawing. Shows that in every tooth there's blood vessels, and even in the sinus, you'll notice it up below the eye part of this skeletal drawing. You can see underneath there's blood vessels in the face, underneath the eye. In the sinuses, we have blood vessels. We have blood vessels in our teeth that go along the jawbone on the top and the bottom, and they travel across the other arteries that are here in the jaw, that travel to the carotid artery. They travel down in the body to the aorta, which has branches that go into the back of the neck called your vertebral arteries. And the vertebral arteries also have a branch called a basilar artery that goes right into your brainstem. Now the pons of the brainstem can easily have an infection because infected sinuses can travel, the infection can travel through a blood vessel that goes right to the brainstem, through blood vessels. Infection from the jaw can go right through the blood vessels that get up into the brainstem to infect the pons. Mercury fillings in teeth called silver fillings or other kinds of toxic substances that are here can easily, there's been recordings on various cameras that the naked eye doesn't see, that these poisons can travel right into the brain, into the brainstem, diseasing the pons of the brainstem in this case for this discussion, as well as other parts of the brain and brainstem and spinal cord can get infected and toxic. But that pons, when it gets infected, what's it going to do? It can actually send out hyperactive signals, even without the bladder full, hyperactive contraction signals. So there are people who tell me, Dr. Herman, I feel like urgency, frequency. I've got to go to the bathroom every 20 minutes or every hour because I just feel this pain, this down-bearing pain, this cramping that's going on in my bladder. They don't call it cramping or pain, discomfort that's going on. Or it feels like a burning. Did you pee and you felt the burn? Well, sometimes it pees when I burn, but sometimes it doesn't pee when, sometimes it burns, sometimes it burns when I pee, but sometimes I have burning just when I'm sitting still. So let me ask you this, without peeing, without going to the bathroom, the bladder area, lower abdomen can have a burning sensation. If you are somebody who's ever exercised in your life, ever done sit-ups or crunches or curls or push-ups or any kind of exercise, you should have experienced, if you did a quality exercise to get to the point of what we call the burn in the muscle. If you curl 10, 15, 20 repetitions with a certain amount of weight, your bicep is going to burn, not because you have an infection in the muscle, but because you exercised it, you contracted it so many times that its burning sensation occurs in the bicep. That can happen in any muscle in the body. Well, the bladder muscle gets contraction signals from the pons. So when the pons is stressed and it's sending out hyperactive signals to the bladder, we have constant muscle contractions like you're going to go to the bathroom, and it can keep contracting to where we feel a burning in the bladder even when it's not a burn during urination. Does that make sense? Pretty simple. Watch this video again if you have to. You can have contraction, so many contractions, constant contractions of the muscle of the bladder that is going to make the bladder feel like a burn even when you are not going to the bathroom. Okay? So when a doctor does an exam on you with a bladder test, a urinary tract infection test, and you show no infection in the bladder, but you're having a constant, frequent trip every 20 minutes, 10 times a night, 3 times a night, 6 times a night, whatever it is for you. And I'm not kidding, I hear all different scenarios from different people around the world, that there are frequent trips to the bathroom, urgency, sometimes a lot comes out, sometimes very little or nothing comes out of the bladder, and the doctors are clueless when they're running tests and they can't find what it is. The pons is one area of your system that I have to check, and I can with my very unique type of bioresonance testing. Not an electrical equipment, no computerized devices. This is not what you might find online when you look up bioresonance, where there's some kind of device that they connect you to that they're going to look and try to let the computer run the scan on you. This is hands-on. I've got to think like a neurologist. I've got to think like a cardiologist. I've got to think like a endocrinologist. I've got to think as an immunologist. I've got to think as an endocrinologist. I've got to have all these different topics, all these different subjects in my brain at the same time and figure out where the symptoms are coming from. I've got tissue samples of the pons, I've got samples of different bacteria, parasites, fungus, mold, chemicals of various kinds that I can find and remedy when they match when they come up to match your body, showing that's what's going to de-stress your tissue. I know that infection is in that pons, for example, or in the bladder, or in the kidney, or in the urethra, or even in your aorta. You can have infection in any of these tissues that's causing the bladder incontinence or IC, interstitial cystitis problem. When we remove these infections from the tissues with very unique remedies that I can provide you, my lab will provide you, you will recover and stop this chronic spiraling effect of not getting rid of your condition and going from doctor to doctor to doctor and all the different labs and all the different hospital visits or whatever you've gone through. You can get well, you will get well, and I'm sure I can help you do that. I'll put the phone number to my clinic here on the screen and the email address to my clinic assistant. You can easily contact my clinic through phone or through email and set up an appointment here. Just to be clearer, that or just to mention this, which I haven't stated before, excuse me, insurance companies do not recognize my kind of work. This is something that will be out of pocket for you, and that's the way that it is. I don't have any control over these insurance companies, what they cover or don't cover. No policy. It doesn't matter which one you think you have. No policies cover this unique work. It's not on your insurance plan, and it doesn't make a difference of which way you ask. I can't get coverage for you for that through your insurance policy. So it is something you'll have to invest in yourself to fix yourself with this condition, and I can help you do that. You will reverse it. You will feel better. You will function better, and that's for certain. Number three here is like me on my Facebook page. I put unique information up there on a regular basis. Go to my Instagram. Follow me on Instagram. I put much information up there as well, in unique little tidbits and good photos and videos sometimes of other people recovering and descriptions of certain things that I'm finding in my lab or my clinic to help people get well. People come to me from all other parts of, I'm down in South Florida at this point. Right now it's 2017, July of 2017. People come to me from in Florida, local and foreign Florida, from other states in the US, as well as other countries. I've had patients come in from Israel. Patients come to me for their help to get well. I've had patients come to me from Thailand, Netherlands, Norway, Italy, United Kingdom, Canada, Venezuela, Colombia. I've had people from many different areas, Mexico, coming in here to get the answers and get better with care. I can help you do that. I can help you recover. You don't have to live with incontinence. You don't have to live with interstitial cystitis, even after the medications haven't worked and you're sick and tired of living with the pad or the diaper. I look forward to helping you.